Hello and welcome to Community Crossroads. I'm Carolina Astrain. Today we hear from Victoria ER, the Kiwanis Club, and the Uniting Hearts Music Festival. We're going to start with Victoria ER. We're welcoming Dr. Gartzman. Welcome.
Thank you for having me.
Well, it's great to see you. It's been a couple of months.
Yes, ma'am.
But I'm always happy to see you. You're an expert in your field, and today we're taking on migraines.
That's Migraine Awareness Month, and so it's a great topic to talk about and bring awareness to because it is just so very common. It's the fourth most common ER complaint that we see. Affects over 40 million Americans, over 1 billion worldwide.
Wow.
1 out of 4 households has someone suffering from migraines. It is the most common neurologic disability in the country.
Yeah.
It affects lost work days, lost school days, affects social life, missed birthdays, anniversaries, special events for families. It is absolutely debilitating and very treatable. And so we want to bring awareness to it because it is so very common.
Well, awareness and also empathy. I don't have Tylenol or Advil or any kind of headache alleviation medication at home because I just don't get headaches. But I think it's important to have empathy for when someone is having a migraine because it's very painful.
Very painful and absolutely incapacitating. And for those who suffer, we want to bring awareness to it because there's lots of resources, lots of support groups online for it, so you can get educated on all the treatment options as well because there's new ones coming out all the time.
I remember driving from Missouri to Texas with my classmate Kelsey Whipple. This was a long time ago, but I would have to take over and drive for her because she would get a migraine and she had to take some sort of medication, an injectable. It was really serious.
Oh yeah, it can affect your vision. It is a stroke mimic, so severe migraines can present with neurologic deficits and numbness and weakness on one side, etc. A lot of patients come into the ER thinking that they might be having a stroke.
And humidity, I know we're kind of averaging about like 80% dew point, something like that the last couple of days. Humidity can be a contributing factor.
Actually, you're talking about trigger points and lots of different trigger points. The weather, certain foods, menstrual cycles with women, and lots of trigger points that can initiate this very, very serious attack that is absolutely, like you said, is incapacitating. You can't even drive.
Are there any kinds of, like predisposed kind of symptoms or traits that a person can have to make them more susceptible to migraines? Is this something that we can detect early on?
Yeah, it's thought that the literature suggests that it is definitely genetic.
Oh, it's genetic.
Largely run in families. Migraine patients often will have a primary relative that suffers from it as well.
Oh, wow.
Yeah.
I hate to have that amount of pressure, right, on your brain. That's what's happening, technically.
Absolutely. It's very scary when it's your brain because, like you said, it's a stroke mimic and absolutely incapacitating as much as a stroke can be, although migraines are reversible.
And what are these medications doing? Do they help reduce the inflammation, or?
It's largely thought that there is an inflammatory component. Absolutely. We used to think it was mostly a vascular disease, but now we know that there's an inflammatory component. The hottest topic right now at migraine conferences, the American Academy of Neurology, just this year at their annual conference presented an observational study showing that the GLP-1s, the hottest weight loss drug right now, may be effective with migraines. They pitted it against Topamax, which is a common migraine medication that patients with chronic migraines take daily to prevent it, and the GLP-1s outperformed it in this one observational study. It's not causation, but stay tuned because there's going to be a lot more studies coming out with the GLP-1s because it's such a big topic right now and so many people are using them. We see a lot of the complications from the GLP-1s in the emergency room.
Is it in a clinical trial right now? Can people sign up to be part of the clinical trial?
You know, that's a great question. After this study came out, I'm sure there's going to be a lot of follow-ups to figure out whether there's teeth in this and whether this is going to be a weapon or not. But it's just kind of cool that it's just it's such a hot topic right now since so many people are using this new class of medication.
Yeah, you're going to have to keep us up to date and come back on the show and let us know what we can do to fight these migraines, because people need to keep working. They need to like celebrate those special moments with their families uninterrupted.
Absolutely. Like I said, it is absolutely incapacitating and is the leading cause of neurologic disability worldwide. So we want to bring awareness to it. Like I said, 1 out of 4 households has someone in their family that suffers from this, and there is help out there and a lot of support.
Well, thank you for the reassurance, Dr. Gartzman. We appreciate you so much and everything that you do over at Victoria ER. Thank you.
Thanks for having me.
All right, well, coming up, don't go anywhere. We hear from the Kiwanis Club. We'll be right back.